This training is on medication storage, proper disposal of medication, and controlled medications. So let's talk about the steps for medication storage first. So medications should be labeled appropriately with the individual's name, the doctor, and the date it was filled. Each individual should have their own locked file cabinet for their appropriate medications. Medications should be kept locked at all times. The keys should be kept on the staff at all times. Do not leave them lying around. And liquid medications should be kept in the same area or the same drawer, but be kept separately away from the other medications just in case of accidental spillage or leakage. If medications need to be refrigerated, they still need to be locked away. So you can put them in something like a little pencil pouch with a lock on the end, but they will need to be locked up as well. So let's talk about controlled medications. So these are medications that can cause physical or mental dependence. Many times these are prescribed for insomnia, anxiety, or severe pain. And they will typically have a C listed on the bottle or the package, so you know for sure it's a controlled medication. So some specifics on controlled meds that you need to know. Controlled medications need to be double locked. So they're going to be typically in the same drawer, the same cabinet as the other meds, but it also needs to be in a separate container like a small box or a pencil pouch. So it needs to have a separate lock, double locked. Controlled meds need to have something called a count sheet, and this will have the consumer's name, the name of the medication, when it was started, and the count of the medication at the time it was started. That's very important. This count sheet will need to be verified and documented at each shift change, and you will need to verify that the count is correct at each shift change. This is very important. You'll need to document the date, the time, and the amount of medication given on the count sheet at each dose. Likewise, the incoming staff should review the medications and the MAR to ensure that the medications were administered and the necessary documentation was completed. Controlled medication count sheets should be completed by both the incoming and outgoing staff as well. Both staff members are to verify and document the number, amount of the controlled medications in the home at shift change. So let's talk about safeguarding keys. Keys to the medication storage are to be kept on the support staff at all times. Keys should be given to the oncoming support staff at shift change when medication sign-off is being completed. But the keys should be kept on the staff member at all times. Documentation. You'll have an appropriate place to document medications given, and there will be a separate training on how to do this correctly. But it is imperative that you document each time a medication is given, no later, but at the time it was given. Now let's talk about medication disposal. This is very important. Medications for disposal will need to be bagged up. You can use a small clear baggie to put the medications in. Meds for disposal would include medication refusals, contaminated meds. So you're going to bag these up and put the consumer's name, the date, and the time on the baggie. You're also going to want to notify on-call or your team leader PM if the patient vomited the medications immediately after giving. Medications for disposal will need to be kept locked up until the nurse comes to pick them up. Never dispose of medications yourself. Do not flush or throw the medications in the trash. You're going to keep these locked up until the nurse comes to dispose of them. Thank you.